Hey, you guys. This is going to be about my relatively pain-free labor. And I know some of y'all just saying, girl, bye. My labor was intense, but I would not describe it as painful. I just wouldn't. I was considered a high-risk pregnancy due to other health issues I had had previously. I do have reoccurring, or I did, because I haven't had any issues since I've had my child. I gave birth to my baby on his due date, which is January 13, 2013, which from what I understand is a little rare. I think it's like 8% people, women, give birth on their due date. So you guys, I think one of my biggest tips would be to do your research. Ask questions. Do not be afraid to ask questions. Question your doctor, question the nurses that are going to be caring for you, tour the hospital. Do as much research as possible when it comes to the labor and delivery. Look at your options. Know your rights as a patient. Okay, there are you can say, no, I don't want that medicine. And you can decline medication, which, by the way, I did not have medication because I just didn't feel like I needed it. I mean, they kept asking me they asked me like every 3 hours, do you want some medication? We can give you medication. I'm like, I'm cool, girl. I'm trying to put my eyeliner on. I'm good. So know your rights as a patient, because I think the more information and the more knowledge that you have, the more confident that you'll be in your decisions, in your delivery. It will kind of relieve some of the anxiety that you will have, especially a lot of women when they go into the hospital to deliver. It's their first time in the hospital. It's their first time, staying overnight in the hospital. You may have had a visit, in an emergency room for any type of reason, but a lot of them it's their first time, especially if you're a first-time mom and etc. For me personally, unfortunately, I've been in a hospital numerous times. At that point, I think it was every year. I've stayed in the hospital overnight. I have a history of ovarian cysts, which are extremely painful. I was on Baby Center, which is an online forum for expectant moms and just moms in general. And so I came across Hypnobaby. I was like, what the hell is this? I'm kind of crunchy. I like essential oils and alternative medicine. I can dig it. So, what basically it is a form of hypnotherapy, and it basically retrains your brain and how it reacts to pain. And it basically involves a lot of meditation, a lot of relaxation techniques. But honey, I was not about to dish out all that money on those CDs. But you know what I did? I actually recorded myself in my own voice doing my own positive affirmations. I would quote Bible scripture. Definitely recommend listening to meditation tapes and meditate in any way that you can. I would recommend 30 minutes a day. Try to do it at least 30 minutes a day. Hell, I did it 2 or 3 hours a day because it's my first baby. I didn't have anything else going on. I had to work sometimes. So yes, hypnotherapy, positive affirmations. Now, when it comes to the labor itself, like I said, know your rights, know as much information as you can. I walked. When I started feeling it getting intense, I actually got up and walked around, and that helped a lot. I also started to creep up my back. I mean, you could feel it. It's an expanding pain, okay? It's a pain with purpose, right? It's almost like an expanding pain. So I could feel it coming up. So I would lay on my side. It would piss off the nurses, but I would lay on my side and it will not be, so bad. Trust your instincts as a mom. If the nurse is saying something, if you don't agree with it, ask questions, ask someone else around you, a family member preferably, but always go with your gut instincts. I think that as a mother, when you're in labor, you can have a lot of doubts. If you're just frantic, that's another situation, okay? But if you deep down feel like something's wrong, or if you want to go another route, trust yourself, okay? You know yourself better than anyone else, all right? Another tip is breathing, y'all. I think a lot of women that when the contractions come, you have a tendency to, take a deep breath in and you stop it, or you're cringing, whatever the pain may be, and you're holding in that breath where you need to release it. Or you could be panting because it's painful. Deep breathing. When that contraction comes, and like I said, you can feel it coming. Breathe in slowly, breathe out slowly. Practice deep breathing along with meditation, okay? A couple of things that I had to keep in mind with, the labor process is that a lot of us as women have been told that, oh, girl, labor is going to be the worst pain you ever experience. The only thing that's worse than labor pain is kidney pain. So a lot of us have this notion already that the labor is going to be extremely painful. So then when we go into it, it's painful. You've already claimed it, girl. Yeah, absolutely, it can be painful for a lot of women, but I guess my point is that it doesn't have to be as painful if you go into the situation with a different mindset. I heard a young lady say on one of her videos is that labor is the easy part. It's the next 18 years that it's going to be challenged. Hell, for some of us, it'll be 21 years, 24, 30 years that it's going to be the most challenging. I am definitely feeling that. I would give birth again like that. Then the 3, 4, and my baby's only 3 years old. This is the challenge. It's actually raising, child rearing. It's also a pain with purpose, okay? There's a reason why you're going through this. Besides Eve eating that damn apple, but so that is it, you guys. If you have any other information out there, advice you would like to share with expectant moms to be when it comes to dealing with pain, let them know. Like I said, I am not in the medical field. Take this information as is. I am just giving you my advice from my own experience. So that is it, you guys. Thank you so much for watching, and thank you as always to my subscribers. Bye.